don't have a bill to even look at. I mean, they're good people on the other side of the aisle, but what they should do is, instead of bashing a bill, is to come up with a bill that we can take a look at with provisions that maybe aren't in the bill that you talked about, or add amendments. They didn't add any amendments. I mean, the amendments that when we worked it out of our committee, we had a lot of Republican amendments in there, and I said to the Republicans, we passed your amendments. Why don't you have where's your bill? Because I think that anything that's really decent that happens out there should be bipartisan, reflects our country. But I'll tell you, I have a feeling here, and I hope it's not true, but at some point, the administration's going to have to decide. Like today, I heard that someone just said that Hatch and Grassley, who said that they thought they had struck a deal, came home and just tore the whole thing to shreds. The president's going to have to make a decision. I mean, I'm not the president, thank goodness, but he's going to have to either say we're going to have to go this alone, or we're going to have to try to see what we can't do to get this done. But this is what's causing a lot of I think, anger and worry from people, because the message changes. And like I said, I just think people are fearful because they're worried about things they don't know. It's very fearful for them. Change is tough.
Folks, we got time for one or two more.
First of all, I'd like to say thank you for coming to the meeting.
You're welcome.
And I really applaud what you shared in the bill about legislation that is going to regulate insurance companies, guidelines. One thing I might just say, if we want to do something through it, I am an advocate for change in the whole healthcare industry. It's a disaster, we know that. Something that has to happen. But when we say government, there's a part of that that says govern. Okay?
Right.
Which means laws, rules, guidelines, regulations, that sort of thing. I think my view is, if you really want to get something passed, you're going to have to limit it to government and not trying to provide additional government programs, even though, and there are ways I think of doing that. For instance, the lady who can't afford this $900, well, that there are tax credits that could be provided for anybody at a certain income level for them to be able to purchase, and the insurance companies and to deregulate. I mean, some of the things that have even been brought up here today, I think, well, shouldn't we start? It looks to me like we're starting at C when we should start at A. Okay.
Right.
And so, like, deregulating the restriction for insurance companies to do business clear across the United States. Okay. Tort reform, immigration. If we get a health care bill that we can't stop the immigration problem, it's not going to help. It's not going to help us as a nation, in my view. That is, it's only going to deepen our debt, which we're already really in trouble. Not only from the current administration, but prior administration. In my view, government is just huge, and it was never designed to do that. It's to govern is rules, regulation, guidelines, tax credits to help people, afford what they need in the healthcare, wherever, certain things like that. So I think that there needs to be some real talk about limiting things to governing and not. I think what at least what really concerns me is when the government wants to implement another program. I mean, thank God for CHIC and for the other things that are happening and all of that, but just to add one more program, which is one more bureaucracy and just all the things that go along with that just terrifies me financially, not emotionally, but just I just know it's going to cost us way more. I mean, the government doesn't have a good record for that.
Well, we've done some. But let me just say,
Republican or Democrat. I mean, because I'm just for reducing government and governing. Do the governing.
Well, here's I think where I would agree a little bit, a couple of disagreements with you, but the government can do some things pretty well. If you take a look at the healthcare system in the country, there are a lot of veterans, not all, but the vast majority of veterans will tell you, and by the way, that's another myth I want to dispel, that if the VA is not melded into any healthcare program, and that would be over my dead body. But the clinics that we've established for veterans to use, the Iowa City Hospital, the other hospitals, some have had their problems, but by and large, most veterans will tell you they like their health care. Now, guess what? Every doctor, every nurse, every clinic, the government runs them. By runs them, I mean they fund them. They don't run them. They fund them. The doctors and the person, the military person goes in, meets with the doctor, the government, provides the health care for them. And we've done that fairly well. On Medicare, we've had problems with Medicare. It is not a perfect institution, but the vast majority of people in this country will tell you that they would be lost without their Medicare. So we need to fix it, but I don't think there are some of those that are talking about abandoning the entire Medicare system. That would, I think, put people at incredible risk. So, but there are things we've done wrong. We've bailed out banks that haven't done anything to help ordinary people out, and that makes people mad. We've seen, as I said, why are we paying under the current plans that we have? So look, you got to look at every plan and say, wait a minute, I have no corner, nor does the government, on wisdom, but we can do things right. But the other problem you have is when you have states that are so upside down like Illinois, $11.5 billion. I feel actually better being in the Congress with what we got than what too, because the problem you have is how do you fix this thing? I mean, it's to the point here in this state, and look, I'm not a state rep or state senator. I don't tell them how to run their business. They don't tell me. But you get to a point where how many more state police or prison people, you can lay them all off. But at the end of the day, you get to the point where you have a couple decisions. You either have to shut down stuff, and that usually ends up coming on the backs of the people who need the help the most, all right? Or you have to take a courage pill and say, look, we got to do something on the revenue side of this thing too. We can't continue to do this. We're trying to fund education on property taxes. We tried in Rock Island County to get a 1 penny thing for education. We got hammered by 65%. People don't want to hear about it. It's the craziest way of funding education. But we have all these teacher pensions that we owe.